In this lecture, we will discuss what R-wave progression is and how to determine if it is normal. The precordial leads or chest leads look at the heart in the horizontal plane. V1 gives the most rightward view of the heart, while V6 gives the most leftward view of the heart of the standard precordial leads. So if you look here, we have lead V1 sitting here, okay? This is the right side of the heart. This would be our right atrium, okay? We can put our left atrium somewhere in this region. This is our left ventricle. Okay, let's use a different color, and this would be our right ventricle. Okay, so notice our right side of the heart over here and left side of the heart over on V6. Okay, now because the bulk of the ventricular mass in normal adults lies within the left ventricle and lead V6 overlies the most leftward region of the heart, we will see the greatest ventricular vectors as we move across the precordial leads from V1 to V6. Okay, in other words, the QRS complexes should become more positive as we move from right to left across them. Okay, so if you notice here, we have a small R wave there. Notice it's slowly getting bigger, 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 and bigger. Okay, and as we move from right to left across the heart, because we're getting closer to that left ventricle that takes up most of the mass in the left of the compared to the right ventricle, and because of that, it's pulling all the forces that way. That's why we see these R waves, this QRS complex is getting positive as our axis is heading more leftwardly. Okay. Now, when we talk about R-wave progression, we're looking at the R-wave amplitude as we move from right to left across the precordial leads. Normal R-wave progression is when the R-wave amplitude increases from lead V1 to lead V5. Okay, so again, let's orient ourselves. We're looking at the precordial leads of this EKG, V1, V2, V3, V4, V5, and V6. Okay, so from the right, and then as we go through here, we're getting to the leftward portion of the heart. All right, and normal R wave progression is when the R wave increases in amplitude from V1 to V5. Okay, usually it's V1 to V5, no, not V6. Okay, so V1 to V5, and if we look here, we're looking at those R waves. So take each of these complexes out. All right, if we take each of them out, you can see them here, and notice that this R wave, okay, a small R wave, smaller, and the R wave is getting bigger and bigger from V1 to V5, okay, and if we have that, if you draw, you see this red line, notice that it's going up in amplitude. All right, and we call that normal R wave progression. That's something what we should normally see. Now, absent or poor R wave progression occurs when the S wave amplitude is greater than the R wave amplitude from lead V1 to lead V5. This may be seen in the setting of an anterior MI, in which the anterior forces are diminished. And then there's reverse R wave progression, which is pretty much the opposite of normal R wave progression. In reverse R wave progression, the R wave amplitude diminishes as you move from lead V1 to V5, or simply doesn't change at all. Okay, and this can be seen in right ventricular hypertrophy. And what I mean by this, if you look here again, V1, V2, V3, V4, V5, and V6, again from the right side, and then we're going to the left side, and we're looking at the R wave. So look at these complexes throughout. And if you look at them here, we're focusing V1 to V5. I just put V6 there so you can see it. But notice that lead V1 already has a big R wave, okay? Normally you don't see that, right? Notice the R wave here is much smaller in these leads. In this case, we have a big R wave, meaning that the rightward forces are dominant. So if you think of it, think of the rightward forces heading this way, okay? Imagine our right ventricle is big in mass, okay? So now our right ventricle is enlarged, okay, such as during right ventricular hypertrophy, and it's now taking our vectors that way towards these leads, okay, and that's why you see those big vectors here. All right, and this is the reverse of what we want. Notice in V6 it's quite low, it's almost going in the opposite direction here. All right, if not just stable. So V1 and V2 heading right over our right precordial leads, sitting over the right ventricle, are pretty much the same, okay, in these leads. And that's what we call a reverse R wave progression. Now hopefully this is making sense. Let's briefly review what we discussed before we end. So again, R wave progression, we're looking at the R wave amplitude as we move from V1 to V5, okay? And we said that normal R wave progression, the amplitude of the R waves of those QRS complexes should increase as we move from V1 to V5, because remember, the left ventricle is the biggest, portion of the heart, taking up the most mass, pulling the electrical forces, and that's why it's really directing most of our QRS complexes, okay? So we saw normal R wave progression from V1 to V5, this increase in those R waves. We talked about absent or poor R wave progression, in which you would pretty much have S waves, so these are the S waves, just pretty much continuing, and we wouldn't see any of the R waves increasing in amplitude, okay? So imagine you just had this V1 continuing throughout, okay? And that could be seen in an anterior MI. Now, we'd also mention reversed R wave progression, in which the R wave amplitude is pretty much decreasing, or we have this big R wave in V1, okay? And normally we said we don't see that, right? Look at these. Barely you can make out the R waves. They're there, but small, okay? But if you have those big R waves in V1, one thing you can think about is right ventricular hypertrophy. Well, that's the end of this lecture. We discussed what R wave progression is and how to determine if it's normal. I hope you learned something.